Hey y'all, this is Dr. Carmen Corder with thedoctornurse.com, and today we're going to talk about the nursing process by request. Alright, so let's just dive right into it. Y'all know that there are 5 parts to the nursing process: assessment, diagnosis, planning, intervention, and evaluation. So let's just dive right in and start talking about the most important part of the entire nursing process. This is the most important thing that you will ever do as a nurse, all right? And that is because everything else here listed on this board, everything else that you do, every medication that you give, every intervention that you perform, every decision that you make as a nurse will depend upon your accurate assessment of your patient. All right, so assessment. How does this part of the nursing process play into your clinical paperwork when you're trying to write up your concept map or your care plan or whatever it is that your nursing program calls it? All right, so let's say you as the student or the future nurse, you have your patient. And if your program operates like many of the programs that I've taught for, you go in the day before and you assess your patient, and then that night you go home and complete all the paperwork that you can on your patient to prepare to care for them the next day. So let's say this scenario. You have a patient who was admitted for an exacerbation of COPD. All right, they contracted some kind of upper respiratory infection and they exacerbated their COPD. You have to choose a priority problem for this patient, right? So let's say you go in to assess your patient and your patient is on 4 liters per minute of oxygen. They're breathing 22 times per minute. They're barrel chested. They get short of breath with any kind of minimal exertion. All right, those are the types of assessment findings that you're going to use to substantiate whatever problem it is that you chose, all right, to address for your patient. So there's lots of ways to go about doing it, but I want to remind you that those assessment findings are so critical to when your instructor goes to grade and look at your clinical paperwork. Well, what assessment findings back this nursing problem up? All right, so all those things that I just mentioned. And let me also tell you that as a nursing instructor, I've been doing this for almost 10 years now, students always forget about lab work when they are, trying to find their assessment findings to back up the diagnosis that they chose. So all those things that I just mentioned, you also would want to look at ABGs. You would also, want to make sure you mention like an oxygen saturation. If you're going to go with infection, then look at the white blood cell count. If you have a patient that's septic, don't forget your lactic acid. Those are all assessment findings. All right, so don't forget your lab work. Don't forget your diagnostic studies. All right, if you have your patient with COPD, like I just mentioned, look at that patient's chest x-ray. I can tell you right now, your instructor will be super impressed, and they'll probably be so distracted by the fact that you included chest x-ray findings that they won't even look at the rest of your paperwork. All right, so assessment. The next part is diagnose, and there are lots of ways about going about doing this. The program that I taught for many years kind of got away a little bit from nursing diagnosis, simply because NCLEX is not going to test you over them. Yeah, I said it. You're not going to see nursing diagnoses on NCLEX. So I'll just leave it right there. So what we did with our clinical paperwork was we kind of had the students focus on a priority problem. So let's say shortness of breath, or dyspnea on exertion, tachycardia. Those are kind of the priority problems that we would have the students address. Now let me caution you with this part of the nursing process. Do not use a medical diagnosis as your nursing diagnosis or your priority problem. COPD is not a nursing diagnosis. It is not a nursing problem. Now, all the signs and symptoms that your patient is experiencing, like shortness of breath, decreased oxygen saturation, increased CO2 levels, mental status changes because of the increased CO2 levels, the risk for safety, the risk for the patient falling out of bed. Think of those things. And always, always, always use your ABCs, all right? Let me just caution you right now, don't go straight to pain or infection as a priority problem. There's 99.9% of the time something else of higher priority, either the airway, their breathing, or their circulation, all right? So nursing diagnoses or priority problems. Next comes the plan, and this is another part where a lot of students kind of stumble around to try to figure out how to come up with a plan. The main things that I want to emphasize about your plan, these are your goals for your patient. So make them measurable, all right? You don't want to have some kind of vague goal like, you know, the patient will not display any shortness of breath. Okay, well, how are you going to measure that? You want something very, very measurable, because when you get down here to this evaluation part, you want to be able to say met or not met and give a number value, all right? So a good plan, for example, going back to our patient with COPD, a good goal, a good plan would be to say something to the effect of the patient will have an oxygen saturation level of at least 92% throughout the clinical day. All right. Now, the other thing, you want to make it measurable, which that is very measurable, 92% throughout the clinical day. The other thing is you want to make it realistic. Now, if this patient is on BiPAP and they're satting 85%, then that's not a realistic goal. All right. But if they are satting around 94% or whatever on their oxygen, then that's a very realistic and measurable goal. All right, so make it measurable. So try to come up with a number value to stick in there and make it realistic. All right, we're not going to cure your patient of COPD. We're not going to cure the infection. We're probably not going to alleviate all pain by the end of the day. So make it something realistic. All right, then comes your interventions. All right, back to our plan, our goal for our patient to maintain his O2 sat. All right, well, what are your nursing interventions? All right, again, start with your ABCs. Airway. We're going to keep the head of the bed lifted up, right? Breathing. We're going to monitor respirations. We're going to keep his oxygen on him. The patient is getting breathing treatments. Don't forget to include those interdisciplinary collaborative interventions, all right? It's not just what nursing is doing, but we are part of a huge team of respiratory therapists, physical therapists, speech therapists, occupational therapists. So include those folks in your interventions and also in your plan. Let me tell you, because breathing treatments are invaluable to a patient with COPD. So include all the medications that you're giving, include the breathing treatments that respiratory is giving, turn, cough, deep breathe. Those are all the interventions that you're going to include in your plan of care to help your patient meet that measurable, realistic goal for the day. And then finally, evaluation. Now, if you have made a very measurable, very realistic goal based off of priorities, based off of ABC, you've inserted a number figure in there, then this part is going to be extremely easy. Was the goal met or was it not met? And how do you know? Well, it was met because the patient's O2 sat did not drop below 93% the whole day that I was there. The goal was not met because the patient did have a drop in blood pressure less than 90 systolic. See where I'm going with it? Make it very measurable, and this part is very, very easy, the evaluation part. All right, so let's just recap real quick. Number one, assessment. These are your assessment data, the assessment findings that you're going to use to substantiate or back up why you chose a particular problem for your patient. So vital signs, lab work, part of your objective and subjective assessment data, diagnostic studies like chest x-rays, include all of that stuff in your assessment. Diagnose. So this is either going to be a nursing diagnosis, such as ineffective airway clearance, or a priority problem, such as shortness of breath, tachycardia, hypovolemia, something like that. Make sure you don't use a medical diagnosis. Step number 3, your plan, or this is going to be your very measurable, very realistic goal. Try to use a number in there. For example, a goal O2 saturation, a goal blood pressure, a goal pain level, a goal temperature. Okay, see where I'm going with it, so you can very easily evaluate that. Interventions, make sure you cater those interventions to your plan, to your goal. Make sure you include other disciplines like respiratory therapy that come in and do breathing treatments. So make sure you include a lot of interventions to address your goal. And then finally, evaluate it. Was the goal for the day met, or was it not met, and how do you know? And that about sums up this video on the nursing process. I hope you have found it helpful. Y'all head over to thedrnurse.com. Under the Smart Study Guide section, there is a neat little infographic there. You can download that PDF version of that, and it lays out these steps of the nursing process for you. You can stick it in your nursing binder, your clinical binder, and take it with you on the go. And I just hope you find that helpful. I hope you find the video helpful. I hope to see and hear from you guys real soon. Thanks so much for watching.